Imagine for a moment, if you could really understand your body's deepest secrets, like peer right into your health future and literally code a healthier destiny for yourself, what would you even do with that kind of knowledge? Knowing, exactly what your biology is trying to tell you.
It's a pretty wild question, isn't it? I mean, for so much of history, our bodies have just been this big black box, a super complex system we've only, partially figured out.
Absolutely. So today we're doing a deep dive into Genosis AI Healthcare. They started up back in November 2022, and their mission, well, it's incredibly ambitious. They want to realize a healthy life for humanity by, and this is their phrase, coding the future of human health.
Yeah, coding the future. It's quite a statement.
Right. So our plan today is to unpack Zenosis's really bold vision, this idea of bringing concierge medicine to everyone. We'll get into the groundbreaking tech behind it and how they're trying to flip healthcare completely.
Yeah.
From just reacting to problems to actually predicting and preventing them. We've got some source material here, and honestly, there's some pretty surprising insights we found.
And Genosis really operates from this core belief, right, that technology isn't just, for convenience. They see it as the absolute most powerful, most essential tool we have for protecting and promoting our health.
Exactly. And that vision, bringing concierge medicine to everyone, it's way more than just a catchphrase. It's really about democratizing access, taking that premium, super personalized healthcare, the kind usually just for the wealthy few, and extending it. They call it universal concierge medicine, making it accessible for all of us.
And their mission statement really drills down on this. They plan to implement this predictive, preventive, universal concierge medicine using their third-generation human digital twin technology, HDT for short.
HDT, right.
The big goal here is, well, pretty huge. Significantly extend our health span, not just lifespan, but healthy years, and totally revolutionize our quality of life.
So the dream is you're not just sitting back waiting to get sick, reacting to symptoms. Instead, you become an active architect of your own health, your own destiny almost. That's a massive shift in thinking about well-being.
And central to this whole idea is something they call the human physiology translator, which really highlights the move away from our current model, disease-centric reactive treatment.
Wouldn't work till something's broken.
Exactly. Moving towards a health-centric, predictive, preventive model. They even have this term they aspire to, holy aging.
Holy aging. Okay, that definitely catches your attention. What do they actually mean by holy aging?
So holy aging, as they define it, it's like a medical revolution that goes beyond just living longer. The focus is on ensuring you live a healthy, meaningful life for all those years. It's about shifting from what they call the mystery of death towards the dignity of life. So having a deeper understanding, maybe even acceptance of our whole biological journey.
Okay, fascinating concept. Let's get into the core tech that could actually make this possible.
Yeah.
Their third-gen human digital twin, the HDT, they're calling it humanity's first human physiology translator.
Yeah.
That's bold.
It is bold, and they use this really great analogy for the human body. They talk about it engaging in billions of molecular conversations all the time, like a grand biological symphony. But, for centuries, medicine has only caught bits and pieces of that symphony, little melodies here and there.
Right, never really getting the full score or understanding the meaning behind it all. Like they say, it's like being an archaeologist staring at ancient hieroglyphs. You make educated guesses, but the translation's incomplete. You miss a lot.
And that's exactly where the HDT comes in. It's positioned as the breakthrough, the human physiology translator that overcomes those old limits. Think about how Google Translate broke down language barriers, right?
Yeah.
The idea is this HDT can break down the communication barriers within our own bodies.
Okay, so it's more than just dumping a ton of health data into one place. The HDT actually creates this sophisticated digital replica of you, like a virtual you. It reflects your individual health in real time. And here's the really interesting part. It has dynamic simulation capabilities for predicting the future.
Exactly, like a living digital mirror that can actually show you potential futures.
Wow.
And this complex digital twin, it's built by combining several key things. Harmoniously, as they put it. First up is the multi-dimensional integration of what scientists call omics data.
Yes, omics data. This is where it gets really deep. It's like your body isn't just one book, it's a whole library. And Genosis is trying to read all the volumes. 6 key types they integrate. First, the genome. That's your basic genetic blueprint, right? Innate predispositions, disease risks.
Yep, your starting point. Then there's the epigenome. Think of this as like annotations or sticky notes on your genome. It's the environmental influence controlling how genes are turned on or off without changing the DNA itself.
Okay, then the transcriptome. This one's more dynamic, showing which genes are actually active, expressing themselves, like right now.
Right. And the proteome, these are the proteins, the molecules actually doing the work in your cells. They reflect your current physiological state directly.
Got it. Then the metabolome comes in. These are the end products of all the biochemical processes, sort of the final readout from everything happening inside you. Genes, lifestyle, diet, everything.
And critically, the microbiome, analyzing all those microbes living in and on you and their huge impact on your health, sometimes in surprising ways. So Genosis pulls all of this together to build your personal integrated omics map.
But it's not just the internal stuff, is it? The second piece is reflecting the spatiotemporal context. What does that mean exactly?
Right, good question. It means bringing in the outside world and real-time body signals. So data from wearables, IoT sensors, think heart rate variability, skin conductance, body temp, blood oxygen.
The stuff your smartwatch might track.
Exactly. And alongside that, environmental factors. Sunlight exposure, air quality where you are, barometric pressure, even seasonal changes. And they stress interpreting this in 4D molecular, cellular, tissue, organ levels, all evolving over time. It's a living, breathing picture.
That's incredibly detailed, a truly dynamic view.
And the third component, maybe the most powerful, is the predictive simulation. They use advanced machine learning for this deep learning graph neural networks, which are really good at understanding complex relationships, like those in our bodies.
Okay.
This lets them predict and simulate the effects of different things, like what happens if you take this drug, or change your diet this way, or get exposed to that pollutant. They describe it as being like experiencing an individual's biological future in advance.
Wow. Experiencing your biological future. That sounds transformative. So, okay, bringing it down to the individual user, what does this actually mean for me? How does the HDT deliver these optimized health solutions?
Well, it offers some really key benefits. First, precise health prediction. They claim the system can predict your risk for certain diseases with over 90% accuracy. So you get this highly personalized guidance way before any problems might actually show up.
Okay, 90% accuracy is impressive. Then what?
Then comes hyper-personalized intervention. Based on those predictions, it doesn't just give generic advice. It suggests super specific diet changes, exercise routines, lifestyle tweaks. It might even flag that you should see a specialist or recommend particular supplements or products tailored just for your biology.
Right, truly personalized, not just eat less salt.
Exactly. And you also get continuous health management. It's not a one-off thing. The HDT keeps monitoring you, sees how things change, and flexibly adjusts your health plan to keep you on track, proactively dealing with any shifts.
And managing all this complexity. How do you interact with it? It sounds like it could be overwhelming.
That's a key point. They promise an intuitive user experience. They're using advanced large language models, think things like GPT-4 or Gemini, to create a conversational interface. So you can just ask it questions in plain English, like you're chatting with someone.
Like talking to a health expert who knows everything about you.
Kind of, yeah. And you get back answers that are scientifically grounded in your unique omics data and real-time signals, but explained in a way that's actually intuitive and understandable. Making that deep insight accessible is pretty remarkable, really.
It really is. Which brings us back to that fundamental shift Genosis is aiming for. Moving healthcare away from just reacting, chasing illness after it happens, to this health-centric, predictive, preventive model. That's the core revolution they're talking about.
Absolutely. And they break down the impact into 3 major changes this shift could bring. First, tackling the massive problem of exploding healthcare costs, especially with aging populations globally. This aging tsunami, as some call it, means way more chronic diseases, and costs are just skyrocketing everywhere.
Yeah, that's a huge issue.
So Genosis argues that by identifying risk factors before a disease even starts, you can intervene preventively, which could lead to huge long-term savings. They use type 2 diabetes as an example.
Okay, how so?
They say the HDT could predict your risk of developing it maybe 5 to 7 years in advance. Imagine getting that warning. You could make lifestyle changes, maybe take specific preventative measures, and potentially block the disease from ever developing. That's not just saving money, that's fundamentally changing someone's life path.
Absolutely. Okay, that's the cost angle. What's the second big change?
Eliminating treatment uncertainty due to individual variability. We all know this, right? People react so differently to the same drug or therapy.
Totally. What works wonders for one person does nothing, or worse, for someone else.
Exactly. And that often comes down to our unique genetics, epigenetics, microbiome, all that omics stuff. So the HTT simulation capability really comes into play here. It can pre-simulate how effective a drug might be for you specifically, and what the potential side effects might be based on your multi-omics profile.
So less trial and error with medications.
Precisely. They mention warfarin in blood thinner, where the right dose can vary tenfold between people. The HTT could help pinpoint the optimal dose from the start, making treatment much safer and more effective.
That makes a lot of sense. And the third big shift.
This one's about overcoming the cognitive limits of medical professionals themselves. I mean, think about the sheer flood of new medical information. Millions of research papers published every single year.
Right, no doctor can possibly read and absorb all of that. It's just impossible.
It really is. So the HTT is designed to be a tool for them too. It continuously learns the latest research, integrates it with the patient's specific data, and provides optimized decision support. It helps reduce that information overload for doctors and, crucially, helps prevent important insights from being missed.
Okay, so it supports both the patient and the doctor.
That's the idea. And all of this loops back to that concept of holy aging.
Right, we touched on it, but let's dig a bit deeper. It's not just living longer.
No, it's about the quality of those longer years. Living healthy, with dignity, with meaning. The HDT is positioned as a key tool for enabling this. It analyzes your biological clock, suggests the best pathways for you to stay healthy. And here's a really profound thought they put forward. Something like 70% of people die without really understanding the underlying biological reasons why.
That's a sobering statistic.
Yeah. Isn't it? Genosis suggests the HDT could change that. It could help you understand your entire life process, like reading your own biological autobiography.
Yeah.
Potentially leading to this clarity, this dignity, even when facing the end of life, because you understand the why.
Reading your biological autobiography. Deep, very personal. So how does this vision translate into this universal concierge medicine in practice, like VIP healthcare for absolutely everyone?
Well, the core goal is democratization.
Yeah.
Taking that exclusive high-touch concierge medicine where you basically have a dedicated medical team on call.
Yeah, the kind of thing billionaires get.
Right. And extending that model to everyone, regardless of their income or background. The aim is to level the playing field, reduce health inequalities, and give everyone that personalized, proactive care.
And the interaction, you mentioned the conversational AI. How does that work day to day?
Through what they call conversational intelligence. Using those advanced LLMs like we discussed. So you, the user, can literally just talk to it or type questions in normal everyday language. And you get back answers that are scientifically solid based on your unique data, but explained intuitively. It's meant to feel like a real conversation about your health.
That sounds much more user-friendly than trying to decipher complex medical reports.
Exactly. And importantly, they also emphasize data sovereignty. They're using blockchain technology for decentralized data management.
Okay, blockchain. Why is that important here?
It's about security and control. It helps ensure your very sensitive personal health information is securely protected. Crucially, it means you maintain full control and ownership over your data. They even mention a compensation model, so if your anonymized data is used for wider research, you could potentially be compensated. You own your data.
That's huge, especially now with all the concerns about data privacy and who owns our information. Okay, so a massive vision, cutting-edge tech, but you need a solid foundation for something this ambitious. Let's talk about their expert network and their patents, their IP moat, as business folks call it.
Yeah, the foundation looks pretty strong on paper. Their team includes some really top-tier experts. You've got Professor Sang-Chul Park, who's a big name in aging research, Dr. Soon-Young Kwon in AI, healthcare, and stem cells, Dr. Jung-Young Kim, focusing on drug development, oncology.
A lot of heavy hitters.
Definitely. Professor Jae-Hoon Lee, who's both a multiomics expert and a clinician. Professor Kyun-Hai Choi in military nursing, oddly specific but interesting. Director Kyu Sung Lim, a gastroenterologist, and Dr. Si Chiol Kang, who seems to run the AI healthcare operations side.
And it's not just researchers, right? They mentioned TV doctors.
Yeah, they highlight a network of over 60 TV doctors, the medical professionals you often see on talk shows or news segments in Korea, which I guess adds a layer of public recognition, maybe trust, and certainly communication skills to their bench.
Interesting strategy. Okay, what about the technology protection? The patents?
They seem to have built a pretty strong technological moat, as you said. They report having secured over 25 core patents specifically for this third-generation HDT. That makes it pretty difficult for competitors to just copy what they're doing.
And what areas do these patents cover? Any examples?
Yeah, they cover the key pieces we've discussed. Things like how they integrate the multi-omics data for the hyper-personalized conversational HDT, the LLM-based real-time conversational health counseling itself. That blockchain system for secure personal health info, that's patented too.
Makes sense.
Also, how they integrate the real-time biosignals and environmental factors for predicting future health. AI methods for subtyping diseases and optimizing treatments based on the individual, and even using high-performance computing, maybe even quantum computing down the line, for simulating human physiology. It's a broad portfolio.
It really sounds like they've tried to lock down the core components. Okay, so technology looks advanced, team seems strong, patents are in place. What about the market opportunity, and how do they actually plan to make money? They have this dual-engine growth strategy, right?
Exactly. And they're positioning themselves right in the sweet spot of some massive global trends. We talked about the aging society that's global, and the demand for personalized healthcare is just exploding everywhere. The numbers for the AI healthcare market are staggering, projected to go from around $16 billion in 2023 to over $180 billion by 2030. Huge growth.
Wow, okay. Big market potential. How do the dual pipelines fit in?
So Pipeline 1 is their future growth engine. This is all based on the HTT technology. It creates this virtuous cycle they talk about. The HTT predicts risks, their services provide interventions, that leads to professional management, and all the data collected feeds back to make the HTT even smarter.
A feedback loop.
Right. Under this pipeline, they have a few key offerings. First, the Universal Concierge Medicine, UCM service. This targets Korean seniors and chronic disease patients initially. It uses the AI chatbot, offers personal assistance, links you to specialists, aiming for low-cost, high-efficiency premium care. And their sales targets are, well, extremely ambitious, like aiming for a 100x increase between 2026 and 2030.
100x, okay. What else is in Pipeline 1?
They're developing a baby digital twin, BDT, planned launch in 2027. This is for parents of babies and toddlers, offering predictions based on genetics, potential talents, disease risks, plus monitoring growth. They call it data-driven parenting.
Yeah.
Also projecting significant sales for this by 2030.
Data-driven parenting. Interesting angle. Anything else?
Yes, a service called AgeWise. They describe it as a health tojong bigyul, which is a traditional Korean fortune-telling concept. But here, it's adapted for health. It gives concrete daily guidance for any adult interested in health and longevity, like walk 30 minutes today, potentially extend your lifespan by 0.2 years.
Yeah.
That kind of specific, actionable advice. Also showing very aggressive growth targets.
Very specific indeed. Okay, that's the future-facing HTT pipeline. What about Pipeline 2, the cash cow?
Right. Pipeline 2 is their MSO and health functional food business. This is what's generating revenue now. And it's crucial because this revenue stream is basically funding the development and rollout of the big HDT engine.
Got it. So the MSO business first. What's that?
MSO stands for Management Service Organization. They say it's benchmarked against the US HMO model, basically helping medical clinics run more efficiently. They have 4 franchise locations now, planning to expand to over 20 by 2028. Key services they offer through these clinics include CGS, cancer gene scanning. They claim it's non-invasive, cost-effective, highly accurate. They also provide protocols for NK cells, T cells, stem cell cultures. These are premium packages, pretty expensive, like 30 million to 200 million Korean won, which is roughly 22,000 to 150,000 USD. But apparently they're covered by private health insurance in Korea and were developed with major hospitals like Seoul National University Hospital.
So high-end regenerative medicine services.
Seems like it. They also supply immune-boosting drugs and health foods through this MSO channel. And this MSO business is projected to be a really significant revenue driver, growing substantially over the next few years.
Okay, and the other part of Pipeline 2 is the health functional food business.
Yes. And this already has some market proof. They mentioned being top sellers in the body fat reduction category on Amazon, for example.
What are their main products there?
Their flagship seems to be cordyceps. It's described as a triple synergy blend combining extracts from Ganoderma pentaphyllum, actoponin, cordyceps mushrooms, cordycepin, and passion fruit. The claims are for body fat reduction, boosting immunity, increasing energy. And here's a really striking claim they make based on non-clinical trials.
Okay.
Scientifically proven lifespan extension effects between 31.5% and almost 50%.
Oh, lifespan extension. That's a massive claim. What does non-clinical mean here, though?
Yeah, it's crucial context. Non-clinical usually means studies done before human trials. So in lab settings, maybe petri dishes, or often in animal models like mice or rats. So while the percentage is eye-popping, it's not based on human results. Still, it's a very bold claim about the product's potential.
Definitely something that grabs attention. Any other key products?
They highlight another one called Fit. They call this the world's first ingestible exercise switch activator, a first-in-class product.
An ingestible exercise switch. How does that work?
It's claimed to activate AMPK. That's an enzyme often called the body's master energy switch. Usually, intense exercise flips it on. This product supposedly activates AMPK without the exercise, leading to benefits like body fat reduction, lower triglycerides, lower cholesterol. And it does have regulatory nods certified by the Korean FDA equivalent, MFDS, and it has a US FDA NDI notification.
NDI, new dietary ingredient.
Yeah.
So the FDA agrees it's safe to market as a new ingredient.
Exactly. It signifies it's been reviewed for safety as a new component in supplements. So yeah, these health functional foods are clearly a key part of their current business, driving revenue while the HDT side ramps up. They project strong sales growth here too.
Okay, so a dual strategy, current cash flow funding, future tech disruption.
That seems to be the plan. And looking ahead, they have very aggressive global expansion plans. Asia, Europe, America, tapping into that huge demand for innovative health tech and AI.
And the overall growth projections reflect that ambition.
Overwhelmingly so. They're projecting total revenue to climb from around 60 billion won in 2026 to potentially 20 trillion won by 2030.
Wait, 20 trillion won? That's astronomical growth.
It is. The compound annual growth rates they project are incredibly high across all segments. Huge confidence in their scaling ability.
And profitability. Can they make money with that kind of growth?
They expect profit margins to improve significantly from 2028 onwards. They mention a low fixed cost model helping with that. The projection is for operating profit to exceed 1 trillion won by 2030. So yes, a clear path to significant profitability baked into the plan.
So summarizing the growth drivers, it's the unique HDT tech with its high claimed accuracy.
Right, that 90% plus prediction accuracy.
The massive market opportunity in aging and personalized health.
Yep.
This integrated trust commerce ecosystem they're building, the world-class experts involved.
Mm-hmm. The team and the TV doctors.
And a favorable regulatory environment, especially in Korea, with new laws coming for regenerative medicine and telemedicine.
Those are the key pillars they highlight. And to fuel all this, they're currently raising money, a 20 billion won Series A funding round.
Okay, and what's that money for?
Primarily three things. R&D advancement, pushing that prediction accuracy even higher, maybe over 95%, adding new disease models, exploring quantum computing. Second, marketing and business expansion, launching UCM widely, expanding the MSO network, entering global markets. And third, recruiting key talent to manage all that growth.
Makes sense. So wrapping up, what's the investment outlook? What are they telling potential investors?
The goal is clear. Become a global healthcare leader by 2030. They're targeting a very high internal rate of return, or IRR, around 55–65%, and a multiple on invested capital, MOIC, of 15 to 20 times the initial investment, assuming a 5-year exit horizon.
High risk, high reward territory.
Absolutely. They're aiming for a KOSDQ listing, that's the Korean tech-focused stock exchange, in 2029, with an estimated market cap potentially between 6.4 trillion and 9.7 trillion. And they also mentioned potential M&A exits being acquired by big global pharma companies, IT giants like Google or Apple perhaps, or even large insurance companies. All plausible strategic fits.
Wow. What an incredible journey we've just taken through Genosis AI Healthcare and their human digital twin. It really paints this vivid picture of a company trying to fundamentally rewrite the rules of health, moving us toward truly personalized predictive care.
It absolutely does. The ambition is undeniable. Now, just step back and consider the really profound implications here. Imagine a world where technology can genuinely read your biological autobiography, like we discussed, and even help you understand with real clarity the biological reasons behind your own eventual death.
Might having that kind of deep, intensely personal knowledge, this intimate look at your own biology, how might that fundamentally change not just how we manage health day to day, but how we actually perceive life, mortality, our own sense of well-being?
It's an incredibly powerful question to leave people with, isn't it? What would universal concierge medicine, powered by this kind of insight, truly mean for every single one of us? Not just as a healthcare service, but as a completely new lens through which to view our lives and our health. Something to really reflect on.